Many people want to know if CBD oil gets you high. This is because CBD can help you in many different ways that many other substances fail to do. However, CBD oil is often made from marijuana that isolates THC, which means you're a lot less likely to get high. This means you can get all of those medical benefits you've heard about without getting high. What is CBD? Cannabidiol, CBD, is just one of the components that are found in the cannabis plant. THC is probably the better-known cannabinoid, and all of the components act as building blocks that make up the cannabis plant's chemical composition. Why you won't get high? Your brain is made up of billions of neurons that make everything such as your senses, emotions, and ultimately your whole life possible. These neurons are not switched on all of the time, but they can be inactive or active depending on what's happening around and inside of you. Neurons emit energy and a receptor receives that energy. When a chemical is present, it plugs itself into a receptor and the neuron is switched on. The neuron that has been switched on makes something else in the body happen. So, for example, a certain neuron is switched on and it makes you happy, or it works to relieve pain. Another neuron may be switched on and it could help to reduce the incidences of fits that are associated with epilepsy, for example. One neuron in particular, which is called the cannabinoid receptor, or CB1, is stimulated by a THC molecule. The resultant effect is that the neuron that has been switched on causes all of the psychoactive effects that are caused by cannabis, such as that euphoric feel. When it comes to using CBD oil, a neuron will not be stimulated in the same way as it would be if you used cannabis. This is because CBD does not completely affect the neuron. What's more is it takes up a bit of room in the neuron that prevents the brain from letting the THC molecule in. In other words, CBD works to inhibit THC. This is the main reason why you will not get high if you stick to using the recommended dose of CBD oil at all times. The side effects of using CBD oil. There are very few or no side effects associated with using CBD oil. Some people do report having a dry mouth, also known as cotton mouth, but this is not the same for everyone. It all depends on how much CBD oil you have used, why you have used it, and how your body reacts to it. Just to reassure you, CBD oil will not make you feel high. This means you should be able to use it as often as you need it without it making you feel euphoric. Please note that if you stick to the recommended dose of CBD oil, you should not feel even the slightest bit high. If you take as much as 1,000–2,000 milligrams of CBD oil a day, then you are likely to feel a little high. What's more is you may not pass any drug test you are asked to take. This is why it's essential that you stick to the suggested doses. CBD oil and the liver. Some people are concerned that CBD interferes with the liver and its ability to metabolize some pharmaceutical medication. This is always possible, so you should make sure you speak to your doctor if you are taking prescription medications and you are considering using CBD oil. Please note that it's important for you to keep taking your prescription medication as required. Again, if you are concerned about using CBD oil along with your medication, you should speak to your doctor. Should you take CBD oil? CBD oil can help to reduce anxiety, depression, diabetes, OCD, seizures associated with epilepsy, and tremors associated with Parkinson's disease. It is also thought to be good at reducing the symptoms associated with schizophrenia. We already know that CBD oil will not get you high, and we also know that CBD oil produces very few side effects, if any at all. The question as to whether you should use CBD oil is entirely up to you. If you suffer from any of the above conditions, it may help you, but there is no guarantee that it will. Everyone is different and everyone reacts differently to any kind of medication or drug that they take. This means that you may not be affected by CBD oil, or it may work really well for you. We have no way of knowing how you will be affected, or how much you will benefit from using CBD oil. If you do decide to use CBD oil to help you with any of your symptoms, please make sure that you use oil that's high in CBD. You should start off using a small amount at first, and you may want to make a note of how you feel after using the oil. If you find that CBD oil does help you, you may want to think about increasing your dose slowly but surely until you get the desired effects. Please note that you should never take more CBD oil than is suggested.